Good morning, everyone, and welcome to Understanding Medicare Basics and Income-Related Adjusted Amounts presentation. My name is Maria Macias, and I am a benefit specialist in the Health Division. If you have any questions, please enter your questions using the Q&A function. So let me bring to your attention the following disclaimers. This presentation is intended to provide a summary of the benefits established by the Los Angeles City Charter, Los Angeles Administrative Code, and LACER's board rules referred to as the plan provisions. In the event of discrepancies in this presentation, the plan provisions will govern at all times. Representatives of LACERS cannot offer financial, legal, or tax advice. Please consult with your financial planner, attorney, and/or tax advisor as needed. As a covered entity under Title II of the Americans with Disabilities Act, the City of Los Angeles does not discriminate on the basis of disability and, upon request, will provide reasonable accommodations to ensure equal access to its programs, services, and activities. And just another little disclaimer, I do have allergies. I'm going through a really bad allergy right now. And so you might hear me clear my voice a couple of times during this presentation, and I do apologize ahead of time. Today, we will be going over Medicare, IRMAA, LACER's Medicare Requirements, and how it impacts you. Before we begin with the presentation, I want to bring this slide to the attention of any active members joining us today. If you are still working for the City of Los Angeles, you are considered an active member. As an active member, you currently have medical coverage through employee benefits, and you do not have to apply for Medicare while working for the City of Los Angeles. You and your dependents only have to apply for Medicare if you are retired and approaching age 65, or if you retire after turning 65. The topics we will be going over today apply to retired members who are Medicare age. Please be sure to contact LACERS if you or your dependents are Medicare age at the time of your retirement. What is Medicare? Medicare is the federal health insurance for anyone over the age of 65. Some people may be eligible for Medicare earlier with certain conditions. This program was established in 1966 and is managed by the Centers for Medicare and Medicaid Services, or also known as CMS. Medicare assists with the cost of healthcare, but it does not cover all medical expenses or the cost of most long-term care. The three main parts of Medicare are Part A, B, and D. Part A is the hospital insurance, which helps cover inpatient care in hospitals, skilled nursing facilities, hospice, and home health care. Part B is medical insurance, which helps cover services from doctors and other healthcare providers, outpatient care, durable medical equipment, and preventive services. Part D is drug coverage, which helps cover the cost of prescription drugs. You may be wondering, when do I have to enroll in Medicare? You can first enroll in Medicare 3 months before your 65th birthday, and you have until 3 months after you turn 65 to enroll. If you miss this time period, you may have to wait until the next Medicare open enrollment period. Not enrolling when you are eligible may subject you to possible late enrollment penalties and losing LACERS coverage. If you are an active employee and or over 65 at the time of retirement, you will enroll in Medicare when you retire. Health staff will provide these members with a special enrollment period form at the time of retirement that will allow you to enroll in Medicare without the late penalty. Lasers does not enroll members into Medicare. You must contact the Social Security Administration. Lasers has requirements to all members or dependents who are eligible for Medicare. According to the Los Angeles Administrative Code, all retired members and any dependents must enroll into Medicare when they are eligible. The member and dependents are required to enroll in Medicare Part B and enroll in Part A only if premium free. You will not be allowed to enroll in a Lasers plan without your Medicare in place. You must pay the Medicare Part B premiums to maintain coverage, and we will go over what can happen if your Medicare lapses later in the presentation. If you retire at age 65 or older, Medicare allows you and or your dependents to defer enrollment in Medicare Part B until you retire. This is known as a special enrollment period. What is an income-related monthly adjustment amount, or also known as IRMAA? Social Security is required by federal regulation to assess IRMAAs on those who have higher incomes as a cost-sharing measure to strengthen the financial stability of Medicare. IRMAA is a surcharge on top of the basic Medicare Part B and D premium rates. And IRMAA is assessed when the Medicare enrollee's modified adjusted gross income, or MAGI, amount from 2 years prior exceeds a certain threshold. MAGI includes, but is not limited to, employment earnings, investment income, capital gains on the sale of real estate, and or gambling winning in addition to the retirement allowance. How is an IRMAA determined? IRMAA is determined by your modified adjusted gross income and your tax filing status. Social Security uses the most recent federal tax return, which is generally from the tax return filed 2 years ago. For example, for the 2023 IRMAA determination, the most recent federal tax return is the one filed in 2022 for tax year 2021. The IRMAA is based on your modified adjusted gross income, is used, and the income levels for IRMAA are adjusted each year. The income levels are based on your tax filing status. For example, someone who files as single will have a different IRMAA income level than someone who files married filing jointly. If your modified adjusted gross income is more than the determined amounts, you will be assessed an IRMAA. For example, for 2023, if you file an individual tax return, you will be assessed an IRMAA if your income is more than $97,000, while the income level is $194,000 for married and filing jointly member. Social Security will inform you if you have been assessed an IRMAA. This slide shows the income table and IRMAA amounts for Medicare Part B. Note, the income levels are based on the tax filing status. The right column has the IRMAA amount. You can see the maximum IRMAA amount for 2023 is $560.50 per month for a single tax filer making $500,000 or more, or for someone filing as married, filing jointly, making $750,000 or more. This slide shows a table for Medicare Part D IRMAA. The IRMAA premiums are on the right. Please note you may be subject to both Part B and Part D IRMAA. For 2023, Single tax filers with an income more than $97,000 will be charged in IRMAA. For married filing jointly, IRMAAs begin with an income of more than $194,000. How long does an IRMAA last? IRMAAs are calculated every year using your income provided by you to the IRS. You may have to pay an IRMAA 1 year, but not the next if your income falls below the threshold. However, if your income increases, then you may be subject to the IRMAA. Social Security will notify you of any changes. This is a common question. Do I have to pay the IRMAA? The answer is yes. If you are assessed an IRMAA, you must pay the Medicare premiums and the IRMAA. As Lasers does not make any payments to collect any payment, you must pay the Medicare premiums and IRMAA to Social Security directly. Lasers also does not assess the IRMAA. If you do not pay the premiums and IRMAA, your Medicare coverage will be terminated. We will go over what happens if you lose Medicare coverage in the next slides. What happens if you do not pay your Medicare Part B premiums or IRMAA? Medicare will terminate your Medicare Part B coverage. Lasers will terminate your Lasers medical plan enrollment for you and your dependents. You will not be eligible for the medical subsidy, and you will be responsible for the full premium payment. Your Medicare Part B basic reimbursement will be terminated, and you will be responsible for the repayment of the reimbursement. What happens if you do not pay your Medicare Part D IRMAAs? It is similar to losing your Medicare Part B. Medicare will terminate your Part D coverage, then Lasers will terminate your Lasers medical plan enrollment for you and your dependents. You will not be eligible for the medical subsidy, and you will be responsible for the full premium payment. Your Medicare Part B basic reimbursement will be terminated, and you will be responsible for the repayment of the reimbursement. There are several ways to pay your Medicare premiums and IRMAAs. If you receive a Social Security check, the Medicare premiums will be deducted on a monthly basis. If you do not receive your Social Security, Medicare will bill you directly every quarter. The bill will have 3 months of premium charges. You can also sign up for Medicare Easy Pay. This is an automatic monthly deduction, and we will go over this more in the next slide. Please note that Lasers does not process your Medicare payments. Lasers does not make any payments to Medicare. Lasers cannot directly pay your Medicare premium from Lasers' monthly allowance. You are responsible for making the payments to Medicare. What is Medicare Easy Pay? This is a free service from Medicare. Easy Pay is a payment option for your Medicare Part B and D premiums. An electronic deduction is set up to automatically take deductions from your savings or checking account each month. This helps you in making your Medicare premium payments on time every month. The Easy Pay deduction is every month instead of receiving a quarterly bill for 3 months, which helps in managing your expenses. Now we will go over some important information about IRMAA. Medicare is a federal health insurance and is a separate entity from Lasers. Lasers do not have jurisdiction toward any requirements related to IRMAA. As a retired Lasers member, you and your dependents are required to follow Medicare rules and policies, as well as paying the Part B premiums, any IRMAAs, and any penalties to remain enrolled in Medicare. We previously went over what can happen if your Medicare lapses. Another thing to know is that the Los Angeles Administrative Code only provides LACERS with the authority to reimburse the basic Part B premium to eligible retired members. LACERS does not reimburse Part B premiums to any dependents unless the dependent is a retired member. Eligible survivors are also not reimbursed their Part B premiums. LACERS only reimburses the basic Part B premium, which is $164.90 for 2023. LACERS does not reimburse any IRMAAs or penalty costs. What can you do if you are assessed an IRMAA? You have the right to appeal if you disagree with the IRMAA decision. The fastest and easiest way is to file your appeal online with the Social Security at ssa.gov. You can also request the appeal in writing by completing a request for reconsideration or form SSA-561-U2, which is also available online at ssa.gov. You can also call 800-772-1213 to request an appeal form or to make an appointment with your Social Security office. LACERS cannot file the IRMAA appeal, as LACERS cannot speak to Medicare or Social Security on your behalf. However, there is assistance available if you need help filing the appeal. You can contact your State Health Insurance Assistance Program, or SHIP. Their website is shiphelp.org. This is a national program that helps Medicare beneficiaries and can help you submit your appeal to Medicare. You can also appoint a representative, like a family member or friend, to act on your behalf. To appoint a representative, you must complete an appointment of representative, for which is available online at medicare.gov, where you can submit a written request. Please visit medicare.gov or call 1-800-MEDICARE for more information. Here is how you can get more information from Social Security and Medicare, as well as other helpful websites like cms.gov, healthcare.gov, and medicare.gov. If at any time you have any questions about your LACERS health benefits, please contact LACERS at 800-779-8328 or email the Health Division at lacers.health@lacers.org and visit our website, lacers.org. Thank you very much for attending. Thank you for attending our presentation today. If you have any questions, please enter them using the Q&A function. Let's give everyone about 10 minutes to ask questions.
Thank you, Maria, for a very informative presentation. Couple of things, as Maria pointed out, the raise your hand option is not active in this presentation. So if you do have a question, please post it on the Q&A feature. But I do want to point out a couple of things. One, if you missed any of this information, not a problem, or want a copy of the slide presentation, the slides are actually available on our LACERS website. If you go to the calendars and events portion, if you go to the news and events portion under the calendar section, you find the event, you'll see a PDF link there to the actual slide presentations themselves. So you can have that at your convenience. The other thing is this presentation will eventually be placed or put or added to our YouTube channel. Lacers has their own YouTube channel, just in case you didn't know. So you'll be able to view this presentation at your leisure. So in case you might have missed anything or joined us late for this one, or just need to leave anytime soon. So with that said, I will hand it back off to Maria to manage the Q&A. It looks like questions are coming in, so take it away, Maria.
So I do see a question from an anonymous attendee. It says, so no benefit for either a surviving spouse or when retired. Actually, if you are retired and you have, you are receiving a pension from us, then yes, you would receive a benefit. I'm not sure exactly what benefit if you're talking about, if you're talking about the Medicare reimbursement, but if you have Part A and Part B as a retired member receiving a pension, then you would qualify for a Medicare reimbursement, not as a surviving spouse. I hope I answered that question. Another question that I see, well, actually our advocates are doing a great job in answering questions. So there's a question from I'm not sure if it's the same anonymous attendee, but they're asking, how can I find out if I have enough FICA credits? Do I contact my Lacers rep? No, you would actually contact Social Security directly. They would be able to tell you if you have enough credits to get a Medicare Part A premium free, or just period if you have enough credits. I have another question from Burnett Daniels. It says, I am retiring at 61. When do I need to apply for Medicare and SSA? So if you're retiring at 61, Burnett, what's going to happen is that Lacers will be sending you a packet 3 months before your 65th birthday with instructions as a reminder for you to enroll into Medicare. So we do keep track of our members, and we do send out those reminders, but you can also contact us 3 months before to get that packet, and you can also contact Social Security to start your process with the enrollment for Medicare Part A and B if you qualify for Part A premium free. There are other questions that members have asked in the past that I would like to review with you guys right now, with the members right now. There's a question that members ask a lot, which is, if I started my employment with the city before April 1st, 1986, which Lacers Medicare plans can I enroll into? What are Lacers Medicare requirements? And what parts are reimbursed by Lacers? So the city of Los Angeles and its employees were not required to pay into FICA Medicare payroll taxes before April 1st, 1986. So members who started their employment prior to April 1st, 1986 may not be entitled to Medicare Part A premium free based solely on their city employment. However, members may receive Medicare Part A premium free if they paid SSA or FICA taxes based on a private industry or self-employment, or through their spouse if they are eligible for Part A premium free when they reach age 62. So I'm looking through the questions. So there's another question. Oh, James is answering it. I could probably still answer it live. It says they're not retired yet, but when they retire next year, is the spouse entitled to any laser subsidy reimbursement? If so, what are the subsidy reimbursements? So no, again, your dependents would not be entitled to a subsidy reimbursement unless they are also a retiree from the city of LA and they qualify for Medicare Part A and B. So another question is, should I postpone my retirement until I get Medicare? If you are still working at age 65 and are covered by the city's active medical plan, you can defer enrollment in Medicare until you retire. During your retirement process, LASER staff will provide you with the additional documentation to take to Social Security to waive any late enrollment penalties. So another question that is asked often is, if I owe a past due IRMAA, can I pay the amount I owe by installments? Yes, according to SSA, you may be able to pay by installments. You have to contact your Social Security office at 800-772-1213 or visit your local Social Security office if you wish to pay by installments. However, please be aware that the Center for Medicare and Medicaid may not allow you to be enrolled in a senior Medicare plan until the balance is paid in full. If CMS does not allow your enrollment, then LASERs may not allow your enrollment into one of our plans. And it looks like our advocates are doing an awesome job answering questions. So, employed prior to 1986 and never paid FICA. Please detail what I should expect when I enroll in Medicare. So more than likely you will not be, you are now 61. So Marianne, Angela's asked this question. More than likely, Marianne, you will not be qualifying for Part A premium free. And we do not require you to enroll into Part A if it's not premium free. It will be extremely expensive for you. And so in turn, this means that because you're not qualifying for Part A premium free and enrolled in Part B, you will not be receiving the basic Part B premium reimbursement. So another member asked, as a spouse age 65, do I enroll in Medicare if covered? So if you're being covered at the moment by your spouse in an active plan and you are 65, you do not need to enroll into Medicare yet. Now, if you are not covered, then and you're 65, then I suggest you do enroll, because then you might incur penalties. But again, if your spouse is an active employee and they're covering you, then you don't need to enroll into a Medicare Part B yet. Now, if your spouse is a retiree and you are turning 65, then yes, you do need to enroll into Medicare also. And we should also be sending you, or we should have already sent you, a packet from LASERs, because you probably being covered under the LASERS plan. So I hope I was able to answer for that question. So I don't see many questions coming in anymore. So Miranda is asking, will I qualify for Part A under my husband? If your husband qualifies for Part A, then yes, you will also qualify for Part A. So any other questions that you might have that are, that has to do with like your own personal Medicare questions regarding, let's say, dependent kids or anything like that, you can contact us at lasers.health@lasers.org, or you can call us at our 1-800 number, which is 800-779-8328. And we would be able to discuss your personal, whatever questions you have on your personal circumstance.